if we look deeper into what owners, operators, investors, asset managers are looking for, you said very eloquently, guys, tell me one thing that works and I put my money on it. I'll follow you. Don't lose me in so many details, because wellness can be a lot of things to a lot of people, and medical goes to every single part of the body and different parts of cells. So there are specialists in every corner. But if we look at the scope again of what could be embraced or addressed with medical wellness, from the holistic traditional medicine with, again, an example, Le Fay Resort, with specific treatments inspired from traditional Chinese medicine and other modalities, to very hard tech-driven procedures offered at, for instance, Clinique La Prairie, when in just a matter of days or 2 weeks maximum, you can have a hip replacement, or you can have gynecology for women with menopause. You can have dental work, because they specialize not only on the procedures, but also on the healing faster and speeding the healing faster, so that when you have just a week or 2 weeks, you can also have several procedures and not just one, and then recover and have another one. So if we look at this big trend that we see with IV drips that are now included in wellness clinics in Dubai, now introduced with Minor and Anantara, with some five-star hotels like Four Seasons and others. If we look at the Medi spas that were included, for instance, with Chibasom in Thailand, where they had that very specific villa inside the premises that was targeting at fillers, dermabrasion, Botox. Where do you see the interest of owners and asset managers going in the in the treatments, offering high results and high yielding profitability?
I believe to answer your question, we have to have one more parameter here: who you want to offer it to.
Yes, the guests.
Obviously, that's a cliche, but what I want to say by this is that if you are in the Middle East, you may have different issues in terms of population, healthcare problems, obesity, having issues with orthopedics. And for those two dominate the discussions, and diabetes. Let's say that's the three. Those are dominating. So anything you want to create, which is relevant to the local market, more like regional market, would somehow shift around all these three modalities or three issues. And obviously, if you could address or tackle obesity, then you can directly have an impact on orthopedics, because one is not independent from the other. Or diabetes, so the whole things can come together and then can become a lifestyle thing, and then you can add some mental aspects to it as well, because then you have to give up a lot of things and it can be difficult, and body image issues and all that. Let's say that's Middle East. If you go to the Far East, it can very much define by aesthetics. And of course, the K beauty, the J beauty, and the C beauty, and all the battle between who is better and who is doing what, and what the treatments are, and all that. It's very beauty defined. So the IV, for example, can be a very popular thing, because it adds the vitamins, the minerals to your skin, and you can see it glowing. And mine was many years ago, so that's why I look like this. So I haven't been to South Korea for a couple of years, so that's the result. I look way better when I came back. But anyway, because I went through all of that. They were very kind, my hosts, and I could try everything and anything. So it was fabulous. I looked at least 10 years younger. But that is very aesthetically driven. And when you come to Europe, you would need to look at it in a little bit more complex way, and you look at, well, it's like a puzzle that do this and this and this and this. because of the conscience is more the totality of it in general, but also I want to give up this and then all I want to do, and I want to focus on that. The mental part is way stronger here. We go to North America as well, then you can, I don't want to mention which property it was, but it doesn't matter. They were promoting it as farming, not farming as in you can herd some chickens as part of your wellness programming. And that was your cover page of that very famous property, that some famous influencers were running around with chickens. And that's what I thought, that now I'm having, my eyebrows were running up a little, that are we serious here now? You're selling me that I'm collecting eggs from a chicken pen, and this is going to be my programming, which I'm paying $1,500 a day for. I have some ethical issues with that, as well as other issues with that, but that's just me. So again, depending where you are, we can always find the actual niche or niches or focuses. Orthopedics has always been a hot topic anywhere you go, from Miami to Dubai. Doesn't matter where you are, because that's critical. And I think what is not orthopedics that you sell, but you sell painless movements. That's what you sell, not orthopedics. No one cares about orthopedics. You care about, I want to decrease my pain load and I want to move about way easier. Done. This is what you're selling. And then you can add on anything. If it's natural treatments, it's going to be Chinese treatment, it's going to be pills, is it going to be diet, is it going to be losing weight, whatever. That's the North American approach to it, that I include anything and everything. My objective is you lose pain level by 50% by the end of the third week. This is the objective. Whereas in Asia, it's like, oh, is my skin tight enough, or do I look nicer? Or in Middle East, it's more like, oh, well, I need to lose 20 kilos. But from the movements perspective, not the losing weight perspective, I want to walk about easier. Therefore, I need to do something with diabetes, need to do about weight, need to do about all the rest of it. So it's very, very particular. And that's why medical wellness as such is a good answer to all these particular needs. This is not just, oh, I'm opening a new wellness unit into a hotel, because the market may not want to have a wellness unit next to your hotel. They want to have solutions, and the more structured approach to it can actually provide that.
That's super interesting, because, and for some people, it could even be eye-opening. When you mentioned that in some areas of the world, it's really the market in medical wellness is really driven by weight management, weight loss, the silhouette, the figure. In others, it's more driven with work to be done on the face, restructuring, resculpting, with ads of fillers or all different types of treatment, invasive, not invasive. You have mentioned at least 5 or 6 times in this conversation orthopedics. And you mentioned the fact that it's not just about the posture, it's not just about the movement, it's also related to pain management.
Yeah.
And you mentioned this in the US. Is it because in the US, there's not just the pandemic about COVID that is rampant and now hopefully being curbed, but there's another pandemic that is rampant and not nowhere being curbed, which is the opioid pandemic. The fact that so many people with pain manage their pain by popping pills. And some people may say, well, that's just numbing what I have. It's not addressing the root cause of what I have. So then, would you say that this is an area to be looked into by, again, owners, asset managers, investors, in not just functional movement with fitness coaches, with possible chiropractors, osteopaths, physiologists, but could it also be tackled by, again, an example, one and only, working with Bastien Gonzalez, who is a fantastic and well-known pedicurist. They started before COVID introducing a special add-on to the treatment, which is an assessment on how you walk, how you stand, and how bespoke soles can be curated for you, orthopedic soles. Is this how far the medical wellness in orthopedics could go? Is it something to look into in Europe or around the world?
Let me add another angle to this, and that is, all this fantastic programming and all these researches and all that's been happening. I'm going to be bluntly direct, if I may. You're making the healthy more healthy. Because those who go to the one and only, just by its brand and all its brand propositioning, more likely to be following a lifestyle in terms of being active, in terms of eating, in terms of a mental state, who would probably respond to this way easier because they know where it is coming from, then they have been involved in other things. So we are helping to keep the healthy, or even making them even more healthy. There's absolutely nothing wrong about it, so don't misunderstand me. So I'm not, cursing that. I'm just saying that is really, facilitating and enabling people who are really conscious, aware, understand, interested to do even more, which is fantastic. They're really appreciating all of this. And we talk about the taking the pill. There is no such thing as losing weight or do anything without blood and tears and sweat. That doesn't exist. That's never been involved. Either you need to have a gastric, band, which is blood, and you need to give up, and then you need to get a more active. There's one of my favorite comedians once said, you know what? It's total waste of money and time to buy dietary books. That's total waste of money. Why? Because there's two things: eat less, move a bit more. The end. This is the solution for weight issues. Obviously, it's not as simple as, but and that is the consciousness of the people. And this is more of a public health issue. Finland did a wonderful job in terms of changing around public health, being the #1 country for suicide in terms of heart spirit consumption and all the rest of it. In good 10-15 years, they turned it totally around. Why? Because governments agreed that regardless of the party lineage, they follow through the diet, the food, the activities, what you need to do in terms of, let's say, summertime walking and wintertime skiing and what you eat and all the rest of it. So they changed it around. So it's possible. But you cannot change those who say that, oh, well, I just take a pill and I don't feel pain, so I'm fine. Masquerading the issue, obviously, because without your actual involvement, physical and mental involvement, it's not going to change. You're just taking more and more pills because you can get used to it, and you take a stronger one and the stronger one, and the stronger one is not going to work. And then you even hurt yourself because you don't feel the pain, so you don't stop. So you just strain yourself even further, and then it can be an issue. So all this fantastic work that's being done from Switzerland to Arizona to Dubai or wherever, kind of trickling it down to have it more accessible. I think that's what medical wellness can do in a way, because if wellness professionals learn reasons, methods, tools, whatever those things are, from the healthcare staff, and they incorporate it into the more mainstream wellness propositioning, then we already access more people. But that's time, because, just the education is that you have medical schools where they don't have wellness programming as part of the curriculum. You have medical schools where they don't have evidence-based medicine. You have medical schools where they don't do even any understanding of what, let's say, spa evidence is, and so on. So we don't necessarily help enough, more like. We have examples, of course, but they don't necessarily enabling this joining forces issue, not yet, or could do a better job.
On the one hand, we see private operators in destinations that you've mentioned, like Dubai, Arizona, and others. And then you mention the public interest for better healthcare, affordable to all, and you mention Finland. Can we go into, because I know you've done a lot of research about wellness travel, medical travel. If we look at cities and destination management organization, DMOs, some of them really position themselves as go-to places for specific operations, like destinations in India. From the UK, there were flights directly flying from Heathrow to different cities, Mumbai, Delhi, to get for operations and come back. Bangkok, lots of operations there, knee replacement, eye surgery, remarkable. Dubai with the Dubai Health Authority. And now, after building the Dubai Health City, building the Dubai Wellness City. Singapore, a few years ago, signing a deal with Fitbit so that Fitbits could be given for free to tens of thousands of people in the population who would agree to pay for the membership to get the data induced. How do you see, or what would be the examples of cities or destination management organizations going onto the bandwagon of medical wellness to be medical wellness destination?
You mentioned a long list of destinations, some of which are tourism orientated, some others are more local community orientated. Tourists can also benefit from it, but it's not the main point. I'm sorry. Especially in the case of Singapore, which was 10 years ago, was one of the first cities in Asia in particular for medical travel. A couple of years ago, officially abandoned topic, saying that we're not promoting this any longer. That's done. We did our bit. We're not doing it anymore. So there are waves of doing so. When we don't just talk about one property providing medical wellness, which itself can define the destination. You mentioned Italy and Le Fais and the Lanzerhofs and all that. They don't have a large offer around them most of the time. They themselves define the destination, and they are more like enclaves in its positive term, in a way. They're just beautiful locations and they're an enclave. But in the termes, let's say in Italy, the Montecatini Terme, Montegrosso Terme, or the Bad, this and that in Germany, and there's a long list of those, or the Vichys, or also the healing destinations in Poland, or they mentioned Pärnu, which has like 5, or Hungary and Heves and all those places, or the Banyas in Serbia or in Slovakia, in Croatia. They have the history of offering more than just one property. Obviously, when you have such amazing, like the Shah, it defines everything, and no one necessarily want to go even close to you because it's just all too overwhelming. And of course, they don't want anyone else either. But we have all those destinations that really have been attracting the Baden-Badens or the Baden-Weins that have cultivated this propositioning: 5-star level, 4-star level, 3-star level, walk-in, staying overnight, outpatient, inpatient. You can find all that on one location, and that exists. And obviously, the DMOs, as the German terminology, since we're going to be in Austria, that exists in German only is the Kurdirektion, which is cure management, which is not a DMO, but operates as a DMO, but it has its own voice saying that we are a healing place. These are the requests. These are the expectations in terms of traffic, in terms of accommodation provision, in terms of leisure provision, in terms of healthcare provision. So we have those notions like the co-direction, cure management, which has its own propositioning and own organization even at a destination, that municipality here, co-direction here, and they need to talk. They need to coordinate their activities and their objectives. And obviously, you don't want certain industries coming in. You don't want certain shops coming in. You don't want whatever activities coming in. Baden-Baden's level of service, as well as brand, is not by accident. That's a very strict ruling in Baden-Baden, what is permitted, what is encouraged, and what is not at all permitted. That's it's a rule book. Well, there's a result to it, so there's no surprise. But when you're in just a one standalone property, and that's for developers that you have to really bear in mind, often you become your own brand, obviously, and the neighborhood around you is just that just exists, and you may even have very little connection with the neighborhood, because you are at the 5-star end. You have very specific healthcare professionals living on site, because obviously it's not available locally. So you really become in a village, and that can cost you a lot of money because you don't have local input. So creating all those fabulous properties and propositions in a destination where you have already healthcare experience, you have understanding by the town hall that, yes, I know what you're doing, yes, very good, come. There's a very different situation from that a standalone greenfield development where no one else exists, and you're literally to the last therapist, you have to import human resources, which will cost you a lot of money and infrastructure and headache. So destination-wise, we have established destinations with a lot of properties, and in many countries, for the matter. Literally, I think it's easier to mention countries that they may not have, because we have so many destinations. But not every one of them call them medical wellness. Some of them call them just health tourism destinations. Some of them want to call themselves medical tourism destinations, and some of them more like in the wellness destinations. And you mentioned Dubai. Dubai Healthcare City, phase 2, is basically going to be a collection of high-end hotel brands with spas. Sorry, that's how it looks like. You can call it as a wellness city, but it's not designed as a wellness city. It's looked at more like a property development, beautiful properties next to each other, not clinics, but more like wellness centers and spas. Nothing wrong about it. That's just one approach. Whereas if you go to, I don't know, Bad Homburg, or really, as I mentioned, Baden-Baden or Vinietka Bania, you might recognize that there is, I think 20 years ago existed a list of necessary characteristics of a health destination that existed, that we have somewhere, that included transportation-related expectations, what is public access, what is sealed off from traffic, in terms of, obviously, guest management and guest flows, treatments which are permitted and not permitted, and so on. So you built it up. These things do exist. I'm sitting in the Medical Wellness Association in the US, and also in the Climatology Association, the International Climatology Association, Tourism Committee. And you can see all these discussions going on. And I think the beauty of talking about medical wellness, that you can bring everybody in. Climatologist, an orthopedic specialist, a bionotherapist for the matter, or a traditional Chinese medicine specialist, a doctor, Ayurvedic doctor. And you can create that DNA, what, in terms of developers we're talking about now, that can define you. You're not just, and this is the moment when I think developers really need to make this note, if nothing else. Talking to hotel advisors is not going to work. Just a standalone hotel advisors, they don't understand healthcare, they don't understand wellness programming, they know urban hotels, 120 rooms. They understand resort hotels, 160 rooms, with some spa on the side. You need to have teams. So whoever you're going to contract, make sure that you have specialists involved. Otherwise, you can jump on bandwagons, you can be led by a fashion streak, which may fade in 2 years' time, and then you invested a lot of space, concrete, technology into something that may or may not work. Medical wellness is a teamwork with healthcare professionals, wellness professionals, hospitality professionals come together and create that programming.